The next part of this lecture is going to be all identification of the blood vessels. So we're going to start by identifying um, systemic arteries, and we'll do systemic veins, and then we'll talk about a few unique circulations. So notice that the systemic arteries are in red, signifying that they are carrying oxygenated blood. So for starters, if we look at kind of the torso region, it's always good to start for the arterial side with the aorta. So the heart would be about right here in the middle. And then, as you're aware, coming off the left ventricle of the heart, you have a big artery called the aorta. Well, the aorta starts right here, and it goes up, and then it turns, and then it comes back down. So this gives us an ascending aorta when it's going up, an aortic arch where it turns, and then when it starts going down, it's called the descending aorta. And specifically in the thoracic region, it's called the descending thoracic aorta. And then once it passes through the diaphragm, it continues on below that as the descending abdominal aorta. And if we look back up here at the aortic arch, you can see there's three major branches coming off of it. So this first one on the right side is called the brachiocephalic trunk. And then immediately the brachiocephalic trunk is going to branch into the right common carotid and then the right subclavian. So you can see the subclavian's going out to the arm. The common carotid's going up towards the brain. So brachiocephalic trunk, which splits into the right common carotid and the right subclavian. On the left side, it's a little bit different because coming straight off the aortic arch, you have the left common carotid, which goes up to the brain, and then the left subclavian, which goes out to the left arm. So there is no brachiocephalic trunk on the left side. Coming back down here, you can see a couple of other relatively easy arteries. So the ones going to the kidneys are called the renal arteries, left and right. Ones going to your reproductive organs are called the gonadal arteries. But more importantly, as we get down here, you can see kind of in your lumbar region, the descending abdominal aorta splits. It splits into a left and right common iliac. And the good thing about the lower part of the body, it's pretty symmetrical. So if we talk about one side, it's a mirror image of the other side. So the common iliac, so this, for instance, would be the left common iliac, continues down a little bit, and then it's going to split into the internal and external iliac. So internal iliac, external iliac. And then it's going to continue down the leg, and we'll pick that up on another slide. If we look out to the arm, you can see that the subclavian is going to continue around to the shoulder, and as it goes through kind of the armpit region or out further out to the shoulder, it's called the axillary artery. So subclavian turns into the axillary. Axillary continues down the arm and where it becomes the brachial in the upper arm region. So this is the brachial artery, commonly used to assess blood pressure if you use a standard blood pressure cuff. Also commonly used for a pulse in infants. And then as it makes its way down into the forearm, it branches into a radial, which is obviously on the thumb side, and an ulnar branch, which is on the pinky side or medial side. And you do not need to be familiar with these arches here, the palmar arches. If we look at the leg, we left off talking about the common iliac, how it branches into the internal and external iliac. If you just follow the external iliac, it comes down the thigh region where it turns into the femoral artery, and then it loops behind the knee where it's called the popliteal artery, and you should be familiar with that term from early in the semester. And then after that, it branches into three branches that go to your lower leg. You have the fibular, which goes out to the lateral side. You have the anterior tibial, which stays in the front, and then in the back, you have the posterior tibial. So after the popliteal, you have fibular out to the lateral side. Front, you have the anterior tibial, and then back, posterior tibial. And one other thing, there is a deep femoral artery that goes deep by the femur, uh, a lot deeper than the normal femoral artery. We look kind of into the abdominal region. We see three major branches coming off the descending aorta. This one's called a celiac trunk. You'll see that on the upcoming slide because it also branches into three major branches. And then you have a superior and inferior mesenteric artery. And anytime you see the word mesenteric, it's generally referring to your intestines. So superior one here, inferior one here, and they both supply blood to the intestines. These are the branches of the celiac trunk. So you remember on the previous slide here, we saw the celiac trunk, and then it branches into three major vessels that supply different regions. So you have the common hepatic, which goes to the liver. Hepatic refers to liver. The left gastric, which goes to the stomach. Gastric generally means stomach. And the splenic, which goes out to the spleen. If we focus on the arteries going up towards the brain, so we left off here with the common carotid coming up. So common carotid comes up, branches right here just below your skull into an internal carotid and an external carotid. So you can see the external carotid stays outside the skull, whereas the internal carotid is actually going to go through that carotid canal that you saw earlier in the semester and actually go up towards the brain. The other big artery bringing blood flow to the brain is this one called the vertebral artery, and you can guess where it gets its name. It passes through the transverse foramina of the cervical vertebra. So you can see it's going right through those little holes and continuing up towards the brain. So that's the vertebral artery. So really on each side you have two major arteries bringing blood to the brain. You have the internal carotid and you have the vertebral artery. The external carotid stays outside the skull. If we look at the bottom of the brain, you can see that you have a lot going on, but if we break it down, here's your two vertebral arteries down here that are coming up. Same ones that we saw on the previous slide, and that you're looking at the bottom of the brain right here, and vertebral arteries coming up, and then here, and here you have the internal carotid. Remember we had one of those on each side, and then they all kind of blend together at the bottom of the brain. So your vertebral arteries, when they come in, they kind of merge into this big vessel right here called the basilar artery, and then you get this circle formed. So this is called the circle of Willis, sometimes called the cerebral arterial circle, but a lot of people just call it the circle of Willis, but this is it. So circle of Willis is a circle of blood vessels right around where your internal carotid arteries come up to the brain. So that's the arteries. Now we have systemic veins to discuss. These are a little bit easier if we cover them second, because a lot of them have the same names. But general rule of thumb, veins are generally more superficial than arteries, but we do have some deep veins. So if you want to remember this, it may help you studying. The deep veins have the exact same names, for the most part, as the arteries did. The only new information you're going to see here, for the most part, are going to be superficial veins, because the deep veins are pretty much the same as the arteries that we just covered. So if we look here and kind of see where we're going to end up with this slide. So I'm going to start out on the arm. You can see we have radial veins. We have ulnar veins, just like we had arteries. We have a brachial veins coming up. So that was the same as arteries. And then up here, axillary vein, and then subclavian vein. So that's exactly the same as the arteries we just covered. So those are the deep veins, and they're in dark blue in this picture. There's three superficial veins in the arm that you should be familiar with. This one right here is called the median cubital, commonly used to draw blood. And then up here we have the cephalic, which is a little bit lateral, and the basilic, which is more medial. And notice how they're a little bit different colored, slightly different color. That denotes that these are superficial veins as opposed to the deeper veins. So to reiterate, in addition to the deep veins that we already covered, median cubital to draw blood, commonly used to draw blood. Medially, you have the basilic, and then more laterally, you have the cephalic. If we look at the leg, really similar concept. So the deep veins are the same as the arteries. We have anterior tibial, posterior tibial, fibular out to the side, popliteal behind the knee, femoral, and then deep femoral also. So that you can see it's almost exactly the same as the arteries. And then you continue up even further, external iliac, internal iliac, common iliac. And the only thing new I'm going to add here is, and it's not circled, is the great saphenous vein. So you have this big vein in the inside of the leg called the great saphenous vein. Something unique about it, it's commonly used for coronary artery bypass surgery. So if somebody has cardiac disease and they decide to bypass the circulation with another vessel, this is the most common one that's used. So the great saphenous vein. You don't need to know the small saphenous vein or the dorsal venous arch. So the great saphenous vein, really important though. If we look at the head region, you have all these sinuses that you actually saw earlier when we were talking about the nervous system, but you don't have to know their names. Just know these are called venous sinuses, sometimes called dural venous sinuses. And they're all going to drain eventually into what we call the internal jugular vein, which carries blood down the neck back towards the rest of the circulation. So internal jugular is important. And then just know that these are called dural venous sinuses. If we look here, very similar to what we saw with the arteries. Here's the internal jugular that we just talked about. You also have a vertebral vein coming through the transverse foramina of the cervical vertebra, just like we had a vertebral artery. And those are going to end up right in where the subclavian vein kind of comes in to the rest. And we're going to cover this brachiocephalic in a moment. So looking at this picture, here's your subclavian that we just talked about, comes in on each side. Here's your vertebral and your internal jugular. And they dump into this area right here. So this little branch right here and this little branch right here, these are called brachiocephalic veins. So you have a right brachiocephalic vein and a left brachiocephalic vein. Remember, for the arteries, we did not have a left brachiocephalic trunk, but we did have a brachiocephalic trunk on the right side. So that's a slight difference. Those two brachiocephalic veins are going to empty into this big vein right here called the superior vena cava, which is going to dump into the right atrium of the heart. So superior vena cava dumps into the right atrium of the heart. Then down here, as we said, you have your internal and external iliac bringing blood back up to the heart. Here's your common iliac veins. Those are going to merge into this big vessel coming up towards the heart. This is the inferior vena cava. So inferior vena cava bringing blood back up to the heart. And it also is going to empty into the right atrium. All right, and then you can see going out to the kidneys, you have the renal veins, which is fine. Reproductive organs, gonadal veins, just like we had gonadal arteries. All right, and so there's 3 new vessels here that I'm going to show you. So, and these kind of drain blood from the thoracic region. So this big one right here, this is called the azygos vein. Then right across from it, you have the accessory hemiazygos, this one right here. So accessory hemiazygos. And then this one down here is called the hemiazygos. So hemi means half. So if you think about this is the azygos, and then this one over here on this side is kind of split here and here. So this is half hemiazygos. So this one down here is the true hemiazygos. This one up here is the accessory hemiazygos. And then if we look internally at the abdominal region, we can see that your intestines are covered by veins, just like they were arteries. And this is going to become important because most of the stuff that we digest and the food that enters our digestive system and is absorbed, it's going to immediately be sent to the liver. And that's going to give us what we call the hepatic portal circulation, which is what we're going to talk about next. So if you can see, your intestines are kind of drained by these mesenteric veins. So you have a superior mesenteric and inferior mesenteric. You also have a splenic vein coming from the spleen. All of those are going to empty into the hepatic portal vein. So really important, this hepatic portal vein brings blood from the digestive system towards the liver, hepatic portal vein. And it goes into the liver, and you'll see what happens in there shortly. But the liver basically filters out all the stuff and figures out what to do with it. And then blood's going to leave the liver in hepatic veins here and here, and eventually dump into the inferior vena cava. So coming into the liver from the digestive system, hepatic portal vein, leaving the liver, hepatic veins, going to the inferior vena cava. So we've seen this before. This is just showing you the pulmonary circulation. I don't really see the need to go through it again, but long story short, the right side of your heart, right ventricle pumps to the pulmonary trunk, which branches into pulmonary arteries going out to the lungs, and the lungs can pick up a lot of the lungs can pick up. You can pick up oxygen there, and then carbon dioxide can be removed at the same time. And this is showing you the pulmonary capillaries, which are going around the alveolar sacs of the lungs. So it's just showing you the sites of gas exchange within the lungs. All right, so I told you I would come back to the liver circulation, and I want to kind of finish up with this because this is really important. We're actually going to see this again with the digestive system, but I do have to bring it up now because it's part of the circulation also. So the hepatic portal circulation is basically blood flow from the digestive tract going into the liver. So when most nutrients are absorbed in the gastrointestinal tract or digestive tract, they're sent to the liver. Inside the liver, it looks like this. You have these little areas. I guess I'll show you this picture again. These little units are called lobules, so hepatic lobules. And that's where all the action is. So if we zoom in on one of these lobules, it'll look like this. And so I'll put all this up here so you can see it. But the blood coming in from the digestive system is here, hepatic portal vein. It's going to flow through these lobules and then into the central vein. The central vein is going to leave and basically go to the hepatic vein that I said earlier. So this is what happens. Blood's coming from the GI tract. It's go in a branch of the hepatic portal vein. It's going to flow through the liver, through these lobules. These capillaries in here are called sinusoids. Remember, sinusoids are really leaky. So lots of stuff being transferred here, and the liver can figure out what to do with all the stuff in your blood. These liver cells are called hepatocytes. So all these hepatocytes are basically getting all these nutrients coming from the gastrointestinal tract. At the same time, they're also breaking things down. Like if you have anything that's toxic in your that you put into the body, the liver tries to break it down, like drugs or alcohol or anything like that. So that's the circulation: hepatic portal vein, sinusoids, central vein. The other cells you have in here, in addition to the hepatocytes, these little cells called Kupffer cells, these are phagocytes, and they kind of break down things and eat things that could be harmful to the body. So phagocytic cells called Kupffer cells are in the sinusoids. And then the other part of this, if you kind of look right around the hepatic portal vein, there's two other vessels. There's a hepatic artery, which carries oxygenated blood to the liver. And then there's something called a bile duct, which carries something called bile. We're going to talk more about that with the digestive system. So to put this in perspective, I'll go back one slide, and you can kind of see that a given lobule has a bunch of these hepatic branches of hepatic portal veins. And so blood's constantly flowing through here and leaving through each of these lobules. And so when you get those three vessels together, the hepatic artery, hepatic portal vein, and the bile duct, that's called a triad, a portal triad.